Thank you for the role that Vanderbilt has played throughout this pandemic and the important role that you play even today. And thanks to you in particular, those of you who are here today that'll be the first recipients of vaccine, but who represent hundreds, thousands of frontline workers who have poured your lives into serving people in this state. We're grateful for your being here today. John, you talked about the over 2,000 patients that you all have taken care of here at Vanderbilt. That's a sobering statistic. And you also talked about those that didn't go home. For the families of the over 5,000 people in this state who have lost their lives to COVID, that too is a very sobering statistic. And it is very true that today's a hopeful day. People have called this a shot of hope, and we celebrate what is a historic moment and a turning point in this pandemic. But my message today starts with saying that we cannot look past the sobering reality of what we're facing here in Tennessee. The sobering reality that we are getting sicker in Tennessee by the day from COVID-19. It's a painful, sobering reality. It's harsh. It may even be inconvenient to some, but we have to talk about that today on the day when we are getting vaccine for the first day in the state. I'm joined by these members of the Vanderbilt medical staff who have been serving patients throughout this pandemic, and a respiratory therapist, an environmental technician, nursing officer. I can stand here and say that the direction of COVID-19 in our state is going the wrong direction, but these people have lived it every single day. They're the ones who see patients gasping in their beds in this hospital. They're the ones who have watched their patients go on ventilators for weeks at a time. They're the ones who've had to share the news with family members that their loved ones have succumbed to the disease while their family members wait outside of the hospital. We do stand here and celebrate a tremendous breakthrough in this pandemic, but there is a darkness before the dawn that's happening right here in Tennessee, and we have to recognize that. Tennessee's cases are surging. The holidays have caught up with us. Decisions that some made during Thanksgiving are having a severe reality in this hospital and all across Tennessee today. One thing that this vaccine will not solve, one thing that it will not cure, is selfishness or indifference to what's happening to our neighbors around us. This vaccine will not cure foolish decisions about how we gather. It won't cure an attitude of a refusal to wear a mask. And it won't cure the idea that I will take my chances and that will not impact someone else's life. I think Tennesseans have a tremendous capacity right now to responsibly make decisions that will serve their neighbor in the process. This vaccine is a very powerful tool, but it will take some time to have a real impact. And in the meantime, it is the very simple things that Tennesseans do that will help us turn the tide of COVID-19 in our state. Your decision, whether you've worn a mask ever before or not, your decision to wear a mask today, for example, may be the decision that keeps you from being treated by these healthcare workers in the weeks ahead. We can and we must turn the tide of COVID-19 in this state, and I need every Tennessean to hear that message loud and clear on a day when we are very hopeful about what these medical professionals and this vaccine will provide for our state. Before I invite Dr. Reese to talk about what this vaccine means for treating workers, for treating healthcare professionals in the hospital. I want to acknowledge the members of the team, again, who have served their state well. Tisha, Akins, thank you. Thank you for making sure that this hospital facility is clean and safe for the people that you work around and for every patient that comes in here. Thank you for that. Lisa Flemons, thank you for using your years of intensive care experience to build a specialized ICU for COVID-19 patients. Vanderbilt's specialized unit has served many families well, and your expertise has been important there. Sophie Whitaker, thank you for keeping Tennesseans breathing as a respiratory therapist, for keeping life-saving breath during their most vulnerable and their darkest times. And Cody Hamilton, thank you for caring for and nursing Tennesseans back to health, fighting through some of the worst days of this pandemic. Robin Steben, thank you for leading nurses with confidence and effectively managing capacity. Thank you very much to every single one of you who have played a significant role, but really who represent the many, many folks who have to face the realities of this every single day. Many Tennesseans don't have to face that reality every day, but you do, and we're grateful for your continued work, and we want to be as great a support as we can to you today. Dr. Rice, finally, thank you for using your vast critical care knowledge to build one of the most successful responses in the country. It's one of the reasons that we are here, because of the successful response of Vanderbilt University and the model that it is to all of America. So thank you for your work there. And if you would please come up and share your perspective on what this day and this vaccine means to your team and to our state.